Hi, everyone, and welcome to Me, You, and Who? Today, I'm honored to have Dr. Jerald Goldstein join me, a leading expert in reproductive endocrinology with a passion for helping families grow. In this episode, Dr. Goldstein shares his personal journey into the world of fertility medicine, diving into the emotional and scientific complexities of fertility treatments. We'll explore the advancements in reproductive technology, the impact of egg donation and surrogacy, and how he guides intended parents through the challenging yet hopeful path to parenthood. Dr. Goldstein brings a wealth of experience offering encouragement and clarity for anyone navigating fertility journeys. Let's dive into this enlightening and heartfelt conversation. Me, you, and who? Who knew it would take more than two people to have a baby? In a world where infertility is no longer a taboo topic, this podcast will take you through all of the different aspects of surrogacy and egg donation through the lens of many who walk this journey in different ways. My name is Whitney Hall, and I am a two-time surrogate, now turned surrogacy coordinator for Egg Donor and Surrogate Solutions, the very agency I used when I chose to carry for two amazing families. With this podcast, it is our goal to help guide and support you as you learn about what it takes to grow a family in an alternative way, as well as hear inspiring and beautiful stories of how this path has changed lives forever. We can't wait for you to hear about just one more way happy families are created every day. Well, thank you so much for being here. I am so grateful that we get to chat finally.
Yeah, it's good. This is fun.
Well, okay, Dr. Goldstein, you are the founder and medical director at the Fertility Specialists of Texas. But before you even got there, what led you to your path to medicine and eventually the specialty of reproductive endocrinology?
Well, I actually, when I went to medical school, I did not really know what I wanted to do,
Sure.
and when you look at obstetrics, I've always been fascinated by, when you think of a pregnancy and sperm fertilizing an egg, and 9 months later there's like a baby. It's crazy,
Yeah,
right?
right?
Literally, it's like when you see a little baby with 10 fingers and toes, little fingers. It's like, how does all that happen? It's really
Sure.
pretty amazing. And so I was always interested in that. Um, I felt like that, in terms of like doing obstetrics, it's kind of like you do a little bit of surgery, medicines,
Hmm.
psychology, you know what I mean? It's very emotional,
Absolutely.
psychology, ethical issues. Patients are, pretty relatively young and healthy. And for the most part, it's a really happy specialty. So um, I decided that I wanted to, obstetrics was really appealing to me until I did that. And then you're like realizing that, you also want to sleep at night. And so, it's
Babies have their own
not,
timeline for
not,
sure.
not a 9 to 5, not a 9 to 5 job. And so that's when I kind of said I wanted to do a do a subspecialty. So
Hmm.
after my residency, then I did a fellowship in, as you know, in reproductive endocrinology and infertility. And then, and that to me was, um, I feel like that in medicine that it's like the best part of any specialty because while I've always kind of thought about you go into a hospital and you see like on the third floor they may be doing a cardiac, it could be a heart, they do heart surgery, and then on the
Hmm.
fifth floor they're doing this, but you may be doing, I don't know, urologist doing prostate surgery, whatever, and on and on. But in terms of what happens in terms of making babies is like better than any of that, and it's more important than any of that, really, because you really have lifelong implications, and it really does change people's life. And so it's like I feel like there's nothing better than that you can do.
Yeah, for sure. Well, it's interesting. You said, obstetrics is a generally happy place, and you're working with a lot of, mostly young, healthy individuals. And reproductive endocrinology is quite a spectrum of all of that. Was that shocking, surprising? How did you navigate kind of the differences?
Well, um, it's not necessarily, I just felt like that it's like that you want to do something that you really enjoy.
Yeah.
And, I don't know how to necessarily say this, but I've always been fascinated by, um, the ability to get pregnant and have a baby
Right.
and carry on with other things in your life. In other words, a lot of patients, a lot of women that we see are like, maybe they're trying to have their first baby, but then they have a child. And it's always been interesting to me how motivated people are to have kids,
Mm.
specifically women, right?
Mm-hmm.
Not to say that men aren't motivated, but
Yeah.
it's in a very different way. And and it's been it, and I feel like, and I've always said it's not like that you have to have kids, but I feel like in some respects to come full circle to give everything that you can give involves being a mom.
Mm.
And um, so it's and so being playing a role in helping that and helping somebody, that you see people that just don't feel like that they're going to be able to get pregnant, and
Mm-hmm.
they just don't feel like it's going to happen, and kind of knowing, rehearsing what you've seen before in the past of people feeling that way and going through the whole process is, that they're different. You're different
Yeah.
after you have kids. And so I just very much enjoyed that. And I kind of like, not that an OB is exciting and everything like that, but it's kind of once you're pregnant, you're kind of like on autopilot in a way. It's very reactive,
Sure.
obstetrics is. And, infertility it's not so reactive. It's more doing things. And it's just very gratifying.
Yeah. Oh
Is is,
gosh, yeah.
is one thing. I think the other thing is that I kind of so part of it is just in terms of helping, um, of helping people do that. I think that also, um, everybody has different experiences in their life that
Mm-hmm.
shapes what they do. But it's like, you know, when I was young, when I was 4, my mom died, and I've always
Mm.
felt like I've kind of been, I don't know, fascinated in terms of almost like making moms in a way. You know what I mean? I don't know necessarily. I
Mm.
don't know. You don't really know why you're driven to do certain things, but it's always been very interesting to me, and it's always been really fulfilling. And it's kind of like, and I tell people all the time, I'm like, if it was up to men to have kids, we'd be like an extinct species because they'd be like, we're going to Costco and we're going to buy a kid. You know what I mean? Because it just wouldn't happen. You know, and so I find it, it's just it's just fascinating to me the differences.
That's beautiful. That's really beautiful. When you mentioned, when couples are coming to you or individuals are coming to you, and they kind of have this resolve of, maybe not resolve, but they're just this path of parenthood is not going the way that they were expecting. And now they're coming to you and there's fear and trepidation. How do you navigate that as their physician? You mentioned that lovely kind of psychology aspect that just always comes with just your role. um how do you navigate that, and then how do you navigate explaining to them that maybe their path to parenthood is now going to involve a third party, whether it's an egg donor or a surrogate?
Well, I think that first thing, it's very helpful for people to have, what you don't know is very anxiety provoking. So
Sure.
when you can provide people information, you can do lab tests, you can do hormonal testing and things like that to give you an idea of the probability of someone getting pregnant with their own eggs or not. then that information is, when it's provided to someone in a kind of thoughtful way, that it helps them get their arms around, and you put that together with their prior history, then it kind of helps them understand why they've had trouble getting pregnant in the
Mhm.
past.
Mhm.
And I think that a lot of times you can't tell someone specifically why they have trouble getting pregnant, or let's say they're having recurrent miscarriages or things like that. But
Sure.
you can provide some information that kind of helps them understand why things have happened to them specifically. And so I feel like that being able to, take it from the unknown to be making it more based on actual information, that
Mhm.
it does provide people. I mean, it's a process of a comfort in terms of understanding why things have happened a certain way they are, and also setting people up for success. And
Yeah.
so when you keep doing the same things over and over again, and you're not really, someone goes through multiple IVF cycles, obviously you can do things to optimize their IVF, their protocol, their stimulation, make more eggs, make more mature eggs, things like that. But when if you've gone through that and and it's still not working, then you kind of have to, then you kind of have to discuss, for example, using an egg donor,
Sure.
or for example, as a surrogate. And I think that while that's not, it's like when I talk to patients, it's like that, you didn't wake up 3 years ago and say, I want to use an egg donor. But the
Sure.
fact is, if you are where you are because of circumstances in your life, and the fact is, if you're older, and the quality of your, and your eggs are, are acting older, then, and the embryos that you're creating are not chromosomally normal, it's not going to make a baby. So we need to kind of figure out what we can do to make that happen. And whether
Mhm.
that, and for example, if you're talking about using an egg donor, then obviously, that, it's pretty rare that you have someone you're not able to get pregnant, and for them not to be able to be parents. It's just a matter of what it's going to take to get them there. And for
Yeah.
example, if you're talking about, if you're referring about using an egg donor, then obviously, they can still carry a pregnancy, right? If you use, they can still carry a pregnancy, assuming the uterus is normal. But the thing is that it's obviously not their own egg. But it's like that, I've never met anyone that, for example, literally that has done that and used, for example, an egg donor and said, wow, I feel like it was a mistake because they're pregnant, they're still
Yeah.
having a baby, and they still, you know what I mean? And they come in like anyone else, and they're like, their life is different. So
Yeah.
I don't know if that's, I think that it's just it's a process. And when you've seen that other people, when you've had other patients, and, after being practicing, I've been practicing for almost 25 years, then you kind of, it's just a process of walking someone through the process to make them more comfortable with, proceeding on, because a lot of it's really difficult.
Sure.
Going through, you're used to getting a lot of negative, bad, and, but a lot of no's and a lot of
Mm.
failures. You know what I
Mhm.
mean? And so, it's
Sure.
hard.
Sure. But ultimately, it is a path to parenthood. And you are, I mean, I think exactly what you said, knowledge is power, and being able to give them, and and parents, the why behind one path not working versus let's go to an alternative, whether it's a different protocol or a different a donor or a surrogate. And yeah, there is something so beautiful about being able to give that knowledge, even if it wasn't the quote ideal plan going forward. How you've been in the industry for, you said, almost 25 years. How have you seen the industry evolve over the course of time? Which I know in medical world 25 isn't a lot, but I feel like so much has happened in reproductive endocrinology in such a short amount of time.
Well, I mean, obviously, when I first started practicing, we did a lot of, almost everything was all basically fresh transfers. For example, when
Mhm.
you go for IVF, now rarely do we do a fresh transfer unless you're like 42 or 43 and you only have two embryos on day two. On you only have, you don't make a lot of eggs, and you're worried, for example, that the embryos aren't going to even make it to day 5. So sometimes
Mm.
I'll be patient. I'm like, you know what? We'll transfer the embryos in your uterus and let your body decide, instead of
And
saying, well,
for those who don't know, a fresh transfer is when you have created the embryos and immediately
right,
transfer
and
them.
immediately transfer them inside the uterus. But most of the time now we do genetic testing in the embryo. So that involves doing a frozen transfer. So you let the embryos grow to day 5 or day 6, and then you biopsy the embryo, and then you get the report back in a couple of weeks that tells you whether it's genetically normal and the
Hmm.
sex if you want to know that information. So most of our, so that's definitely a difference now. Before everything was fresh transfers. Now it's rarely do you do a fresh transfer, and the success rates are better using frozen embryos. It's not so difficult. You're not so, when you think about going through, for example, an IVF cycle and you have like a lot of eggs, you're really uncomfortable. So when you transfer an embryo 5 days later, it's a lot. You know what I mean?
Yeah.
So it reduces the risk of ovarian hyperstimulation. Frozen embryo transfers seem to have babies. When you look um, at outcomes from the baby subsequently, they seem to be healthier, have less issues later on.
Mm,
And obviously you can do, genetic testing. So that's one big change in terms of
yeah.
that. Um, I would say the other thing specifically regarding surrogacy is now, for two guys going through, it used to be really, really difficult to find a clinic that would do that. And there's a lot of roadblocks. And now so now, when you talk to, when you talk to, for example, two guys that are going through, whereas before they felt like that, that by coming out that was basically they're giving up their ability to be parents. You know what I mean? That it
mm,
was really going to be an
yeah.
option, and now it really is an option, and
Hmm.
it's just mainstream and something we do. That it's that you're able to obviously go through and create embryos and do split insemination with the sperm from both of the guys if that's the case, and follow the embryos out and test them and see if they're genetically normal, and then find a surrogate and transfer the embryos and their parents.
Yeah.
So it's that's something that's now very relative, really very common.
For sure. And FST has been huge in that. I know we had Dr. Scora on our podcast a while back, and I know he has done so much to further y'all's program specifically for LGBTQIA plus people seeking out wanting to be parents. So I think that's such a huge advancement just in kind of the culture, if you will, of the infertility world.
Yeah,
Yeah.
yeah. So in fact, I'm going to Brussels like tomorrow, actually, for men. I don't know if to speak to men having men having
Yeah.
babies conference about about that, where there's a lot of a lot of gay guys that are very well informed, that are very motivated, and they could have a
Hmm.
kid like anyone else.
Yeah, for sure. Absolutely. What gets you excited about where the industry is heading? Because it has evolved so much, whether it's a medical advancement or what's getting you excited?
What makes it's exciting? Well, I think that obviously the success, there's a couple things. One, success rates have improved
Yeah.
tremendously over the past 20 years. I think that fertility is becoming more mainstream. It's
Mm-hmm.
becoming not as expensive. In other words, that there's a lot of when I started practicing, I started this clinic in 2005, right? Fertility Specialists of
Yeah.
Texas. Um, Probably most of the patients that went through, it was they didn't have coverage for insurance.
Sure.
Now, the other way around. Now, most of the patients, 70% of them probably have insurance. And so that's providing the option of people going through and having kids that was not, they didn't really, that option wasn't available then.
Yeah.
So that is, I think, is good. I feel like that everybody deserves, the opportunity of having kids,
Mm-hmm.
and hopefully it should not be financial. It's one thing if you're talking about you want to go and I don't know buy some you know Louis Vuitton clothes or things like that. But you're talking about having a kid, right? You're talking about
Yeah.
having children, and so that I think should be available to people because it really changes your life.
Yeah. Absolutely. Absolutely. Going to speaking to egg donors, potential egg donors, surrogates, potential surrogates, what are maybe some of the common misconceptions that people have when it comes to third party surrogacy and egg donation that you feel like you see frequently or have seen over the course of?
Well, I would say that the biggest thing in terms of using an egg donor is that, again, you don't, I'm speaking mainly from, obviously from a female perspective, that it's like you don't wake up and say, I want to use an egg donor to build a family. You know what I mean? But the fact is that, for women in particular, that are in school longer, that second marriages, things like that, that is, they're, as you get older, it's harder to get pregnant, right?
Sure.
Because you're born with all the eggs you have the day you're born. Men are making sperm every day. You see men in their like 70 having
Yeah.
kids when you look at that moment, right?
Right.
Not fair, but I mean, that's, and so the thing is that I think in terms of using an egg donor, that it's really the fact that while if it turns out that you've adjusted the protocols or you've done different things and you still are not able to make viable embryos, that using an egg donor is you're still the mom, right? You're still
Yeah.
carrying the pregnancy, right? And the thing is that when you're, even people that I know that it uses their own egg, a lot of times a baby comes and they're like, I don't even know where it came from. You know what I mean? In terms of, what I mean? And so the thing is that, and I think so making that transition to the fact that you're willing to use it, that you're not, and you're not giving up, and you're not a failure, and you're not,
Yeah.
because I think that it's really, really oftentimes, you know, things are internalized to make it where like I'm a failure if I can't, have a baby
Mm-hmm.
using my egg. And so making that transition and realizing, and for example, and I really encourage people, for example, you're talking about that particularly, like people that are considering using an egg donor, to talk to other women that have used an egg donor and ask them, does the baby feel like this is their baby? You know what I mean? Do they,
Yeah.
because the thing is, these concerns that you have are not really, what I mean, it's what you think about. But the thing is that it's not, that it doesn't turn out to be the case in reality. And they're like
Mm-hmm.
saying, yeah, transferred embryo, or my mom, I have 3 other embryos frozen, on and on and on. And it's like, I've got too many other things to worry about right now in terms of, worry about that. And they're like in a different place.
Yeah. Well, and you're so right. And even if you do end up not only needing an egg donor but also needing a surrogate, you are still that
So,
parent
so
at the end of the day.
they're using a surrogate, for example, and we do a lot of surrogacy. But the thing is that, whether it's their egg, for example, or using an egg donor, but the thing is that, a surrogate I mean, luckily you find someone that's very motivated to carry a pregnancy for you. It's gone through the
Yeah.
screening, healthy and things like that. But it's like, once the surrogate delivers, and then, it's your baby, and
Yeah.
I mean, and you still have, um, you know, and so it's like, that doesn't, although most of the time I think that, I mean, that's why it's always interesting to me that, like, for example, because women, again, and this is maybe just the way that I think, and it's like for women, I feel like that, many times if it's a, husband and wife, that they were very upset, and disappointed in not being able to carry a pregnancy.
Sure.
But if you switch that around and you made it where like it was the male that was carrying the pregnancy, I don't think you'd have that same disappointment. You know what I mean? And it's just the way their brain is. But the thing is that they, you know what I mean? So I always wonder why, what I mean? Not that you can't, that can't necessarily happen. But the thing is that they would be like, man, I was able to figure it out where I don't have to use it. I don't have to carry, I don't carry a pregnancy, but it wouldn't be that, you know what I mean? But they
Sure.
wouldn't necessarily miss the fulfillment of carrying of carrying a pregnancy. It's just fascinating to me.
It is fascinating.
Yeah.
But I think you're so right. There has been so much advancement, and third party specifically is becoming a whole lot more mainstreamed, but I think there is still a stigma, and there is still, like you said, kind of this obstacle of failure that some people have to overcome. And I think you're so right. At the end of the day, you're the one picking the name, you're the one making the nursery, you're the one planning the future for that little one, and you're going to
Yeah.
be mom or dad, no
Yeah.
matter how they get here earthside.
Just a different pathway. Sometimes in your mind, you think it's going to be one way,
Yeah.
it doesn't work out that way. It may be a different route, but the end point's the same.
Yeah, absolutely. Well, and I feel like that is what infertility or reproductive endocrinology is a lot of pivoting and a lot of exploring different pathways for
Yeah,
sure.
yeah, yeah.
Yeah. What advice, just from your perspective as a physician, what advice would you give to intended parents, gestational carriers, or egg donors as far as if they are thinking about, just going through this as a way to parenthood or thinking about being an egg donor or surrogate? What advice would you give them?
I would say don't give up.
Mm.
That it's so easy to go through the process and being conditioned to have a lot of negatives, a lot of
Yeah.
no's. You feel like you start saying, well, maybe we weren't meant to be parents, or maybe
Mm-hmm.
it's not meant to be, or a number of different reasons. But the thing is that in general, again, you have to every case is different. That if you
Yeah.
can, that it can happen, and if you know what I mean, if you figure out the right, you know again, every case is different, but it can that it's worth it in the very end because you're it's again not that you have to have kids or what I mean, but the thing is, but your life is really is very different. So don't give up. And the other thing is that I'd say the second thing is to seek out a lot of you know a lot of opinions. You know what I
Mm.
mean? People that you trust and someone that you resonate with when you talk to them, they feel like that they understand you and that you really, you know what I mean, that and you look at, and when you're when you're, for example, at a clinic, for example, that you're looking at success rates and
Sure.
things like that, as you know, there's like two different parts of what we do. There's a physician component and a laboratory component.
Yeah.
And, and even though a physician can be a really, really nice person, if the lab is not that good, well, then it can make a difference. And literally,
Sure.
sometimes that can make a difference between whether you're a parent or not. You know what I mean? And
Mm-hmm.
so, and not to say that we're like the absolutely best, but you know what I mean? But I'm saying that it's just always interesting to me that, that you make sure that that you check the boxes and you're at somebody that you're comfortable with, but you're also somewhere that you can look at their outcomes and say, okay, what's the probability of someone like myself getting pregnant and going home with a baby?
Yeah, for sure. For sure. How would you navigate kind of educating yourself, specifically if you are wanting to be an egg donor or surrogate? Because I feel like, again, over the course of time, it went from few clinics, few agencies. It was kind of, a bit of a small world. And now, you have social media, you have the internet, you have so many ways that you can get a hold of information, whether it be correct or not, you can get a hold of information. What would you say is the best way to navigate finding where to start and where to get good information, true information?
Um, well, I mean, obviously, you could talk to your friends that have gone through the process. You can talk to
Yeah.
people like you know what I mean, well, I'm saying the thing is that I think that people, for example, whether you're with an egg donor agency, a surrogacy agency, or things like that, they're able to look at a lot of different places and see how
Yeah.
people do, depending on where, what's going on. I mean, I think that, um, obviously online at different reputable fertility clinics of, seeing what's
Sure.
on online. And obviously I mean, I think that that's really the best place to start talking to friends and, just being very curious and,
Mhm.
and so, um,
Building that trusted team.
yeah,
Yeah, and keyword reputable.
yeah, yeah.
For sure, for sure. What would you say sets Fertility Specialist of Texas apart from other clinics that are out there?
Well, I think that we have a great staff, right?
Yeah.
So obviously it starts with the doctors, but it's actually the nurses and the other staff that are more important than that.
Oh,
I
shout
feel
out to
like
nurses.
that they're really motivated to, to making sure that people are well taken care of. I mean,
Yeah.
I think that that's really important. I think that the embryology, we've had our embryologist, Dr. Guerrero, has been with me since I started, since the
Mm,
facility. And, that you have a really, again, it's always been interesting to me. You talk to a lot of different fertility clinics. Everyone says they're the greatest and the success rates are on and on and on. But,
sure.
excuse me, that the going to SART, Society of Assisted Reproductive Technology, and looking at live birth rate for clinics,
Mm,
because that matters. It really
yeah.
matters in terms of, the number of people that went through, how many of those people went home with a baby, live birth rate. So you should know that wherever you're at. So I think that we have a really good, good lab. And I think that I think in general, it's like we say what we do and do what we say. And,
Mm,
again, not necessarily everybody that, that goes through fertility is necessarily pregnant, but you want to be somewhere where, people are like really giving it their all, so to speak,
yeah.
and you're going to pull out any stops because for you, it makes a difference of whether you're going to be a mom or
For
dad.
sure. Yeah, for sure. For sure. What would you say is your favorite part about what you do? And I know that's a tough question because I know you love almost everything that you do, but what would you say is just that thing that gets you up and gets you excited to go into work?
The favorite thing that I like to do is someone's gone through treatment and doing a their first OB scan,
Yeah.
because when you're doing a first OB scan, you walk in the room. Typically, it's between 6 and 7 weeks. They've already had blood tests that shows that they're positive, and you're doing a ultrasound, and doing general measurements, and then you look at the
Sure.
pregnancy, and usually at that time you can see and you can actually hear the heartbeat. So a lot of times, when I see patients, I always like say, I'm talking to them as we're going through and doing a scan, and then I'm like,
Yeah.
do you remember the very first time we talked? They're like, yeah, I remember this and that, on and on and on. And I'm like, well, what were you, um, there's one thing that you were thinking about that you probably don't realize you were thinking about. And they're like trying to think, well, I don't know really what I was, I was nervous.
Sure.
And at the same time, I have like the ultrasound probe where you put it on M mode, basically, where you can hear the sound. And then you put the
Yeah.
sound on, and when you hear this, and then you can hear the heartbeat. And
Mm,
and so I feel like that, maybe it's just in my mind really, but I feel like that when people hear that, when that there are, when you like, when moms and dads, both of it hear that, I almost kind of imagine that their heartbeat kind of comes down a little bit as well. You know what I mean? Because it's like the very
yeah.
first time that they're hearing, a heartbeat, and I'm like, your life is going to be really different.
Yeah.
And I love it because,
Oh.
what I mean? Because it's like it's, it's like amazing,
Yeah,
right?
it's
There's nothing else.
magical.
There's nothing. Yeah, it's magical. You know what I mean? And so
Yeah.
when you look at, you know, Houston, for example, I don't know, there's 4 or 5 million people in Houston, but like
Sure.
that, there's probably very few. I don't know how many times. I mean, maybe there are, but in terms of people after going through IVF, where you're doing that at that time, it doesn't happen a lot. Maybe it's happened. I don't, you know what I mean? It's just
Yeah.
that it's not happening in a lot of places. You know what I mean? At least when you're after someone's going through IVF and they're listening to listen to their heartbeat, and so that's like, the very first time. And I feel like that when you talk to moms after that, or dads, you know what I mean, and they're like, they remember that. You know what I'm
Yeah,
saying?
for
They
sure.
remember that. It's like that's the, it's amazing.
That was it. Yeah, you made that dream come true. And yeah, oh,
Well, both of us made it, not just me, the staff, and but it's just like,
yeah.
it's a magical moment.
For sure. Oh, that's beautiful. That's beautiful. Well, okay. My last question for you. For anyone who knows me, they know that I have a very codependent relationship with coffee. Coffee and I get along beautifully. And so I always like to ask the question, what filled your cup today? Literally or figuratively, what was the thing that filled your cup?
Wow. I mean, I have a cup. I've always drink the donut brand, the Dunkin' Donut brand of coffee.
Oh,
But
very good.
what filled my cup? I mean, I think that every day, luckily, mostly, um, for example, for me, it's like, like even like today when I had someone that came in and did their first, OB scan. I mean, that to me
Yeah,
is what makes it really worth it. It makes everything else worth it in terms of what you do. Obviously, you get paid for what you're doing or things like
sure.
that. That doesn't really ultimately, I mean, it's like this, it's a different level. So
Yeah.
that's really what for me is is the best part of what we do and really makes it really worthwhile, and where you really know that you've made a difference.
Yeah. Oh, for sure. For sure. Well, thank you so much for all that you do. You are such a difference maker. And we are so grateful that we have gotten to work with you for so long
Yeah,
and
absolutely.
have been a part of that trusted team and just continue to appreciate all that you do. So, thank you so much for your time.
Thank you.
Thank you so much for joining us on this episode of Me, You, and Who. We appreciate your time and hope you enjoyed our discussion today. As we wrap, we would like to remind you of some of the ways that you can stay connected with us and be part of the Me, You, and Who podcast community. Firstly, if you haven't already, make sure to subscribe to our podcast on your favorite platform. Hit that subscribe button so you never miss an episode and can stay up to date with our latest content. But that's not all. We also have an exciting YouTube channel where we share some bonus content, behind the scenes glimpses, and video versions of our episodes. Head over to YouTube and hit that subscribe button there as well. And don't forget to click the notification bell so you'll be the first to know when the new episodes go live. And for more exclusive updates, engaging discussions, and a chance to connect with fellow listeners. Be sure to follow us on our social media accounts. You can find us on Instagram, Facebook, and TikTok at Create a Happy Family. If you're interested in finding out more about creating a happy family, please visit us at www.createahappyfamily.com. Thank you again for being part of the Me, You, and Who community. Your support means the world to us. I can't wait for you to join us next time as we continue to share stories and journeys of creating happy families.